Okay, let's study the first point on the finger for Master Tung. 11.01 Dajian. Number one, in the context of Master Tung's theory, which organ pair embodies the principle of complementary interaction that is specifically linked to knee pain manifestation? Knee pain, small intestine. Okay. So
Heart.
answer.
Number two.
Number.
Two.
Number 2.
Yes.
Kasi yun lang yung narinig ko kanina.
Yeah. So heart and kidney. Yeah, heart and kidney. A depth of 2 to 2.5 fun for accessing the small. Di ba mas malalim if you have hernia, no? Small intestine reaction. So assuming 1 fun equals 0.1 tun, what is the equivalent depth? Diyos ko, para naman tayong elementary.
Math pala to.
Parang nagko-compute lang. Okay. Kaka-insulto. So the answer is number.
Number 1.
When locating the Dacian point, I'm sure you remember the Dacian, no? Hawakan nyo na. How many fen are measured from the median line to the radial side of the proximal phalanx of the index finger? So median line to the radial side. Ilang fen?
3 fan.
Wow, right. Dr. Okay. Dr. Tung's protocol for male patients before noon, before noon, dictates needling on which hand and what underlying TCM principle does this reflect? So dapat mag-appointment siya before noon.
Before noon.
Yeah. So what's the
Yeah.
answer here?
Left hand
Left.
kasi male siya.
Or,
So number 2.
Number 2. Yeah. The chi side that commands blood. So pinapagalaw natin yung blood. Which nerve provides both dorsal, digital, and palmar proper innervation to the index finger? Just in case somebody will ask you that.
Meron ba magtatanong sa atin?
Oo, meron.
Talaga ba?
Yung mga pasyente mo katulad ng ng taga Dumaguete rin nakilala ko.
Okay. Radial kasi nandun siya sa may ano ng
What's your answer?
radial.
radial daw.
Yeah. The inch measurement, the tun, approximates which anatomical dimension commonly used in Chinese acupuncture?
Oh, width of thumb.
Kasi if
Width
you
of
really,
thumb.
really care for your patient, I think you might want to teach the patient how to use, especially kung meron naman siyang lancet na ginagamit for, di ba? Width of a thumb, yeah. Width ba? Ay, width of a thumb. Which
0.5
organ's reaction area is explicitly omitted from the Dacian points listed associations?
Liver.
Hindi kasali si liver. The primary, basta think of heart, kidney, small and large, no? The primary pathophysiological explanation for heart-related knee pain. Heart-related, actually it's the small intestine, no? Pag sobra ng pain, involves which, syempre pag pinag-usapan si SI, we think of heart, yeah.
Of heart, yeah.
Involves which of the following mechanisms?
The heart.
It's number 2. Kasi
Number
yun yung heart.
Heart vacuum
Acuity
failing.
failing.
Okay, because there
Steam
is, ganito kasi, mahina si heart, so hindi niya ma-steam out si excess water. Which procedural action is explicitly prohibited when needling the Dacian point? Grabe naman ito.
Bilateral.
You don't do bilateral. Okay. The anatomical structures described as deep and superficial muscle tendons of flexor digitorum. You have to memorize also the muscle. Correspond to which pair of muscles? Siyempre, yun din.
Number 2.
Number 2,
Long.
superficialis and profundus. What's your answer, Ma'am Trix?
Number 2.
Of course. Sinabing flexor digitorum, diba? The Dajian point is most effective in treating which of the following conditions?
Hernia.
Yes. What is the
Yeah.
reason? Kasi
Uh,
mahina si heart. So, which side of the body is associated with blood? Contrasting with chi on the opposite. Mahina si heart, so nagkaroon ng heat. Remember, when you have like yin deficiency, di ba? Nag-heat siya. So, nag-spill over yung heat niya sa SI, kaya nagkakaroon ng pain. When you have hernia, intestinal, no? Nagkakaroon siya ng... Okay, use the 11.01. Which side of the body is associated with blood, contrasting with chi on the opposite side?
Left is chi, so right.
Right side. Okay. The notation 0.3 in the point's location likely stands for which measurement unit?
3. Soon. 0.3.
0.3.
0.3
Which
soon.
statement accurately reflects the reciprocal vacuity relationship between heart and kidney?
Number 3.
Yeah.
Number when the organ is
Sumasabay din, no? When one organ is vacuous, the other, or very deficient, the other is partially vacuous as well. So another term for deficiency. The U channel mentioned connects the index finger point to which organ's meridian pathway?
U channel.
liver.
Liver? Ah,
U channel.
Index finger. Ay, iba.
U channel, hindi ko to alam.
U-chan.
Anyone knows the answer? Sino may alam? Okay, let's leave this at that. Okay. Google.
It's the lung.
Yeah, the lung. Oh, yeah, makes... Ang galing niya.
Index finger.
Oo nga, no, si heart lang. Wala kasi si heart. The lung. Thank you, Sister Rosa.
I cannot see because my laptop is low Wi-Fi. The all are blurred. All are blurred questions. I cannot see.
Okay, you just listen to the voice.
Yeah, thank you.
I'll just ask for a copy of the questions. Which condition does not employ the reverse correspondence of hand and body for the Dajian point? Okay.
Which one is
Not employ
the reverse correspondence of
shoulder stiffness.
Shoulder stiffness. Oh. For intestinal hernia treatment, which depth range in inches is recommended for needling this point? Superficial or deeper?
recommended for needling
Dapat
this?
deeper, di ba?
Kanina point, di ba?
Mas malalim. What's the answer?
Number 3.
0.2 to 0.25. 0.3 is too deep naman. The modern, basta pag heart lang, 0.1 to 0.2, no? The modern anatomy note lists the reaction area of the Dajian point as which combination of organs? Ay, wow.
Modern
Number 1.
Yeah, heart, small intestine, large
and
intestine.
large intestine.
To lessen insertion pain, which maneuver is recommended para hindi masaktan?
Number 2,
Number 2.
you grasp the fleshy part.
Yun naman talaga gagawin natin. Masakit pag hindi mo ginaidan. The claim that this point can treat numbness of finger illustrates which broader principle of acupuncture?
Can influence peripheral nerve. Acupuncture points can
2.
influence peripheral nerve function.
Yes. Yeah. Peripheral nerve. Why is using the left hand advised exclusively for needling this point in men?
Number 2. Left side
Because
relates to chi.
left side relates to chi. Yeah.
The commander of blood. Which condition is repeatedly described as most effective when treated with the Dajian point, indicating therapeutic priority?
Hernia.
Yeah, hernia. Converting
Yeah.
point one to point two tsun to fun, which fun range does this correspond to?
1 to 2.
1 to 2.
1 to 2. Kasi
Yeah, point one to point two tsun eh. Okay. How are gender-specific point selections scheduled for Dr. Tung students before noon? Wow.
for men,
Number
men
1.
receive,
Left
Right
side.
side.
di ba number 2? Kasi men
Number
receive
2
left
pala.
side
Number
points.
2. Mm-mm.
Yeah, number 2.
Women right
Women
side
right
points. The expression small intestine chi oblique hernia is best interpreted as which of the following?
Number 3.
Yeah, meridian disorder. Which symptom is not used to differentiate kidney knee pain from heart knee pain? So in other words, kung may issue ka sa heart, magsasakit din yung knees mo. Di ba?
Oh.
My goodness. So, masakit pa rin yung tuhod ko ngayon.
Tumakit bigla.
Numbness.
Numbness, yeah.
Um,
You'll always look for swelling, heat, and redness. So, if you have knee pain, tingnan mo muna yung knee. So, ngayon, lab na labo na, ay, nawala yung pain bigla. Dapat before noon.
corn.
The dorsal, digital, and palmar arteries supplying the index finger arise from which artery?
Radial.
Okay. So, to be specific, yun, inaano natin. Dorsal, digital, and palmar. O, diba? The use of fire and water metaphorically represents which organ interaction?
Heart and kidney.
Okay.
So, number 2.
Yeah.
No.
The claim, when one has heart disease, one can automatically assume that there is also kidney disease. Ay, ganun pala yun. Exemplifies which TCM
Yes.
principle?
Zhangfu.
Yeah. Is it true? Ay, parang
Yeah.
hindi. Zhangfu ba?
Hindi ko rin alam, Doc.
Pero firewall.
Ay, hindi naman pa.
Firewall.
Okay, Zhangfu. Arrange the 3 depth recommendations for this point from shallowest to deepest. Saan dito ang shallowest?
Shallow.
Yung fun ang pinakamaliit. So, 1
One fun.
Point 1 din yun eh. So what's the answer? Yung
Number 2.
deepest.
Number 2.
Okay.
One fun. One fun.
Number 2.
Yes.
Deeper needling at this point sa Dajian is results in what change to the therapeutic scope?
Deeper needling.
Deeper needling expands the range of treatment.
So if you want to treat the hernia and the pain, okay, which organ's reaction area includes inner canthi eye pain? You know where that is, no?
The heart.
Masakit sa medial canthus. The answer is?
Heart.
Heart. Ay, buti na lang, hindi sumasakit yun.
So safe pa tayo.
Which of the following is a contraindication for needling the Dajian point?
Treating both
Yeah,
hands.
only one, ha? Baka nasanay kayo sa sa traditional.
Ba't pa kayo? You can't treat simultaneously eh. Diba?
Yes.
So, ang contraindication is cannot do simultaneous.
The U channel traverses the index finger
Hindi naman si U channel.
with which meridian? Diyan na naman si U channel.
Wait, ano ba yung question nung kanina about the U channel?
Yan, same
Mention
din.
connection index finger point to which organ meridian pathway? Ang sagot kanina lang, Doc. Pero ngayon pareho din meridian din yung ano, pero walang lang na.
Walang lang. So
Walang lang. So hindi siya
walang
lang.
sagot. What's your answer, Ma'am Trix?
Liver kanina.
Liver po yung
Liver. So the answer kanina should be liver.
Is it the same question? Oo, diba?
Okay, so the answer should be liver. Which component, kasi dapat may epekto sa liver. Which component is omitted from the regional anatomy description of this point in the modern anatomy section?
Lymphatic.
Lymphatics. The subcutaneous branch of the radial nerve refers to which specific nerve?
Palmar. Proper name.
Okay,
Palmar.
Palmar. Which condition can be directly addressed by needling this point at a depth of 0.1 to 0.2 inch? 0.1 to 0.2 lang. That means 1 to 2 fen.
Heart.
Okay, siguro kung tutusok-tusukin mo ito parati, no? Mag-iipon. Try daw natin. The triad distinguishing heart knee pain from kidney knee pain consists of which signs?
Swelling, heat, redness.
Okay. Which acupuncture point is cited as a comparator for eye-related symptoms treated by this finger point? So this can also treat the eyes. Kasi di ba the heart nandoon sa inner canthus? Ay, sa canthi, di ba? Lateral and medial. So what's the answer?
No, LI3.
Huh?
LI3.
LI3? Or bladder 2? LI3.
LI3.
LI3. Kasi doon,
LI3.
yung ba? Oo, doon, LI3. Bearing down sensation of the testis is treated as a manifestation of which condition?
Bearing down. Orchitis.
Architis. The small intestine reaction area of this point would most likely address which symptom? Oblique hernia. Why is it asserted that the deeper the insertion is, the further the indications will be?
Deeper insertion reaches deeper tissue layers, influencing additional organs.
Of course. Which gender time side combination correctly follows Dr. Tung's teaching for point selection?
Man before.
Man before noon, left side.
Ang galing. Okay. The reaction area combination of heart, small intestine, and large intestine aligns with which elemental sequence? Okay. In classical TCM theory.
Firewood.
Earth.
Fire, earth. Fire, earth, metal. Paano na ba punta si wood?
Fire.
Earth,
metal. Heart.
Fire, earth, metal?
Fire.
Bakit si earth? Bakit
Fire.
Heart, small intestine.
Small intestine is fire, diba? So heart. Small intestine at saka heart. Fire.
Heart and Lung.
Ang large intestine
LI
is
is lung.
metal.
Pipilian natin yung 1 and 2. Diba? Kasi dapat may metal
Basta may
and fire.
metal.
Pero ang tanong, sino dyan?
O kasi may
Number
fire, may metal. Kasi parehong ang SI tsaka heart, parehong fire, Doc, di ba?
Oo nga. Si LI, kasama
is
sa
Si
metal.
L ay metal.
metal. Mm-mm.
Okay. Si large intestine may connection kay stomach.
O kasi dadaan muna sa stomach. So earth,
So
heart,
I think the
earth,
best
and
answer is fire.
metal.
Fire.
Fire, earth, metal. Ano, tama ba? Fire, earth, metal. So number 1.
Yeah. Okay. Which rationale is not provided for selecting the left side for needling in men?
Number 3, anatomical ease of access.
Yeah, that is not the rationale, no?
Yeah.
Men's diseases are more relatable. Okay. Wow. Do you agree with that? Ay, wala pa lang nakikita si ano. Wow, thank you so much. Is that your answer also, Ma'am Trix?
Yes, Doc.
Yeah. Anatomical ease of access.
So Doc, may
Okay.
tanong lang ako doon sa U channel kasi ngayon ko lang na ano yung U channel. So kaya siya liver, is
Ay.
it because, di ba yung liver channel, it forms like a letter U?
Mm.
Sa, pag tinignan mo siya sa map ng ano ng
Oh,
meridian, yun ba
memorize mo
yun?
talaga, pati yung trajectory. Wow. Ang tindi. Okay.
Mas ngayon ko lang na ano yung U channel eh.
Yan. Wow.
Kaya
Congratulations, everyone. We'll proceed to the next one.